Speaking of the beast system, beast system.
You are already sort of a cybernetic symbiote. Neural nets are taking over from regular programming. So you are connected.
This is from Bloomberg. And the headline, the first commercial brain-computer interface is entering human trials. Elon Musk's Neuralink is overtaken by a rival in a race to regulatory review. So the technocracy, I think it's important to keep in mind with any kind of new world order. It's not just like one person in charge all the time. That seat, that throne is sort of up for grabs, right? And there's competition going on. And so it's just, and Elon is just one of the players in that technocratic race. So anyway, let's see what this says here. Synchron Inc., which develops a so-called brain-computer interface and competes with Elon Musk's Neuralink Corp., enrolled the first patient in the U.S. clinical trial, putting the company's implant on a path toward possible regulatory approval for wider use in people with paralysis. The early feasibility study is funded by the National Institute of Health and will evaluate the safety of the device, known as the Stentrode, the New York-based company said. It will also assess how effective the Stentrode is in helping patients control digital devices hands-free. Here we go. And again, if you're not seeing the connection to extrasensory perception and controlling UFOs, it's kind of the mind. It's the stuff of the mind. Your imagination, your pineal gland, perhaps. It seems to be something a little bit more spiritual going on than simply the physical, although we are at this point in time in history where, because of technology, science increasing to the point that it has, it is starting to tinker with the very fabric of the stuff we're made of, the material, and tapping into that immaterial aspect of ourselves and of creation. And that's what things like connecting directly into the brain seem to do, because the brain being the main organ that processes information in this physical world through, different senses, it is a very, perhaps one of the most powerful things in creation. And, to tap into it somehow, into, some kind of bridge into that mind realm, there's some questions about what's going on here when it comes to Neuralink and these brain-computer interfaces, all in the guise of helping people with paralysis and things like that. But you never know what other things are being collected and learned behind the scenes here. But here's what it says as we go on. It also puts Synchron ahead of Neuralink, which is better funded, but is still recruiting a trial director. Neuralink raised $205 million last year. Synchron has raised $70 million in total. That's not that much. Brain-computer interfaces, or BCI, could empower millions of disabled people to more easily communicate and engage in modern life. Paralysis affects more than 5 million people in the U.S. alone, according to researchers at the Center for Disease Control. Farther in the future, Musk and other technologists talk of a world where anyone can receive implants to achieve a sort of super intelligence. And that's the other thing, too. Elon probably doesn't see this as competition. He's probably like, yes, another tree being grown over here. And eventually we will intermingle and become one. Synchron's device, once implanted, travels to the brain through blood vessels. Neuralink is implanted directly into the skull, in parentheses. After it reaches the brain, the Stentrode translates brain activity into signals designed to allow texting, emailing, online shopping, or other activities using an external device, Synchron said. In the past, other BCIs have received regulatory approval to treat patients on a temporary basis. Synchron's trial, if successful, would secure approval from the U.S. Food and Drug Administration for long-term use, not just for experiments like those in a lab. Here in this article about brain-computer interfaces, we see the three organizations that did not instill confidence in the public over the last few years with this pandemic. We have the NIH, National Institute of Health. We have the FDA, and we have the CDC, all giving their stamp of approval for moving forward with putting little microchips in your brain. I don't know if this is good. The Synchron study will eventually involve 6 U.S. patients, splitting between New York and Pittsburgh. The first patient enrolled this week at Mount Sinai Hospital in New York. Tom Oxley, Synchron's founder and chief executive officer, declined to identify the patient or provide demographic details. It was Joe. What if it's Joe? Oh, man. Cybernetic Joe? That would be phenomenal. All he has is a soundboard of all the things he's said. That's how he communicates. It's kind of like an enhanced version of Stephen Hawking.
Come on, man. And Corn Pop was a bad dude. Keep yapping, man. It's really a productive segment, man.
I'll stop there. I can go on for a while with this board. But anyway, the next step on the path toward approval would be a wider trial to test for efficacy. If the trials succeed, it will likely be several years before the Stentrode is available for sale. So there you go. They're saying it's still a few years away. But what, few years away for what? Commercial? As a commercial product or as a product for people that, are paralyzed? Not clear. So there you go. There's some beast system connected Elon update. And yeah, so you talk about Elon and Starlink, Neuralink, taking over Twitter, which is sort of the blueprint of internet hive mind. And you have aerial surveillance, government bodies creating aerial surveillance to get more data about what's going on up there. Starlink would be a great little partnership to have for the U.S. government. Hey, just put a few more cameras up there on the Starlink you got, facing the other way, maybe not facing down, but like facing up, and we can start plotting every molecule in the sky, and then we will know when these craft travel. And that's what's very fascinating too, because once we have this surveillance, this aerial surveillance or whatever that they're trying to establish, and how much of it is going to be public? Probably not all of it. Here's the other thing. They probably already have this, right? A deep underground, secret government, whatever you want to call it. They must have a more robust surveillance apparatus of everything in the heavens, or at least close. So for a government body to start saying, hey, we need more surveillance, now you're getting the general public in on what's happening up there. And it also happens to be the same realm where, this new level of warfare, the space warfare type thing, but also where the technology will exist, theoretically. For the, I know some people don't believe space is real, but it breaks down if we're not clear about what we're talking about. It's going to be the place that houses the technology that connects people on the internet. And, Ellie Marzulli has talked about this for a long time, and I completely agree with him on this, that the internet itself is a sort of recreation of what New Agers call the Akashic Records. It's this ethereal network of information, of all information that exists in some kind of non-physical space that the ancients were able to access somehow. And if you think about what the internet is, that's exactly what that is. It's a big non-physically existent. I mean, there are physical locations where that information is being fed, right? These on-ramps and off-ramps from the physical world where we're instilling information into this non-existent cloud type of thing. But that's basically what it is. And so if you have Neuralink connecting to your brain, and then all the communication apparatus from your brain goes to the cloud or the thing in the sky that's floating around, and then now you're talking about craft up there. I mean, this is crazy. This is craziness. As it were in the days of Noah, right? So anyway.